something that we should bear in mind because it's not only our time, it's the patient's time. So we need to do it, even though it might not be our fault directly. Because the thing is, when you're inside an office with a doctor, you want to stay there forever. You want to get all. Some people bring grocery lists to me. And I learned from my sister who's younger, okay, well, we can't do all of these things today, but which are the three that are most important to you? Perhaps we could deal with those first. You know, that kind of way? So you get, because it can be difficult. And then when the patient goes outside smiling and happy, everybody's like, it took so long inside there. But when they get in there, they do the same thing. So that's a very, very good point. Any other comments? Remember, we're dealing with a social medical issue. It's not so much the content in terms of the medical terms, because you're all doing that. It's more the softer skills. The slide is on the board. The kinesics, the oculesics, the proxemics, haptics, and locals. You wouldn't have been able to see the eye movements too well, at least not if you're in the back. But body language, did you notice any leaning towards or moving away or on either side? It's only your first one, so maybe you wouldn't have noticed everything. Maybe in the second and other interviews you'll notice a bit more. You look as though you're totally bored, are you? No? Just a look? That's body language. So. Just say. Yes, Rajendra.
It looked like Bill wasn't really making much eye contact from where I was sitting, and I wondered if you thought that was indicative of anything.
Okay, you mean if you thought it was part of the skit, or if it's part of just what happened?
Either, actually.
Okay. Was anybody able to see Mr. Carter inside? Would you like to make a comment?
I noticed that it was on the table, but I
Right. Yes. I actually noticed that too, and I thought it's because he's just, look, I've been waiting here so long, my foot, my ankle hurting me, and you taking long and thing. I don't have to look at you. Patient? We can go off script for a minute.
No. I should start by apologizing to Dr. Hannah, but I thought that I was deliberately being difficult and crotchety and in pain and not very cooperative. I could have played it differently, but I think that is useful for the situation. I think he managed it very well, of course. Ashraf has tremendous patience. Sorry, Dr. Hannah has tremendous patience in his personality. But what you have to think of as doctors, it's like Dr. Cameron. If you really are not a very patient person and you're faced with somebody who's being that difficult, your first inclination is really to get irritated. So you have to ask that and know that about yourself. So I was deliberate, yes, I was looking at him and so on. I think he managed quite well.
Those standing by the door, please come. There are seats available. Not quite standing room only. Yes, Mr. Carter, I think that everybody, I think Rajendra asked that question to elicit exactly what you had done, to show that this was deliberate, and just to make sure that people did realize that he wasn't making eye contact, and I'm glad you were able to corroborate that. Excellent. Okay, if there are no other burning observations, then we'll move on to the next vignette. But I would like to ask you, having gone through this one, you sort of know the types of things that we're looking for, and if we could note them, and maybe they can be used later on for discussion, even if they're not aired at this point in time. Yeah? Thanks. Mrs. Williams will introduce the second scenario.
Dr. St. Bernard will be adopted to Janet for John.
Hello, good morning, ma'am. Would you like some help to your seat? Okay, you have a seat right there. All right? Okay. Good morning.
Good morning, Doc.
I'm Dr. St. Bernard.
Good morning, Dr. Sandra.
I'm happy to see you.
You are? Oh, I'm so glad. Doc, I'm really tired, you know.
You tired? All right, I have your file here, but I'm just confirming. Just remind me of your name.
Jennifer John.
You want me to call you Miss John?
2 ends on one F, eh?
2 ends and 1 F, yeah?
Because people like to give them one end and
I
another.
can well imagine.
Yeah.
What would you like me to call you?
Whatever make you happy.
Alright, well, I'll stick with Miss John, if that's okay.
Okay, well.
So what brings you by today, Miss John?
I'm so tired. Oh Lord, I can't sleep. Oh my Lord, I'm tossing and I'm turning all night. I can't stand up to wash the dishes no more. After I wash 2 glasses and a plate, I have to go take a rest.
I remember we spoke about this before, Miss John, so I'm glad you're back.
You
Tell me
glad?
some more. No, we needed to clarify and see how things have been going. So what you tried so far has not been working with regard to the exhaustion you're feeling?
Yeah, and the headache. Oh Lord.
Oh, headaches.
Oh my Lord.
Is that new?
Well, kind of, you know. It wasn't so bad last time.
Right.
But it's real bad. But the Panadol ain't working no more.
Okay.
I tried the paracetamol too, but I
Right.
can't work it either, you know.
Okay.
I don't take it often.
Well, what about the diet we spoke about?
You know, I still like the chocolate.
Oh, right.
And Christmas, I did black cake. Oh my God, cute.
Mm-hmm.
I alone over the Christmas with a whole black cake.
Oh, no.
I can't.
But Miss John, tell me something. Do you remember the last time we spoke and we talked about the sugar and how it affects pain?
Oh.
Do you think the diet over the Christmas may have anything to do with what's happening with you now?
You might have a point there, you know. I didn't think about that, but you might have a point. Yeah. Oh, start to cut on the sugar.
You do.
Well, I mean, the black cake done,
Well, thank God for that.
but it's still not chocolate.
Well, the thing is,
You sure you give me a
I
too
can
much
give you a
chocolate?
stronger painkiller, Miss John.
Mm-hmm.
But do
It
you
will
want
work?
to keep, wait,
Okay.
do we want to keep eating the chocolate and have to keep taking more and more painkillers which could affect, you know, the kidneys and so on? Or do
Okay.
you think we should perhaps try a little harder to cut back on the chocolate so you do need to take painkillers that could damage your body?
Okay,
You tell me what you think.
I can try that because you know I've been.
Mm-hmm.
The 2 daughters getting married just now, so you know I have to be with them right now.
yes.
Start to look a little,
Yes,
you know.
absolutely.
So we can try the diet. I might take it off a little few pounds, you know.
Yeah.
But I'm really gonna look good for the wedding.
Okay.
Because there's 2 of them. One time,
Well,
you
it
know.
sounds like you're already planning and you're taking control. Right? Those weddings are coming up this year?
Yes.
All
2
right.
of them, you know. I can't do that. 2 of them one time.
Miss John.
I'll get some grandchildren.
Indeed. So in terms of these weddings that are coming up, apart from avoiding the chocolate, would you like to perhaps look at other things in the diet?
Well, yes. Yeah.
What about the fruits and the vegetables and so on?
Vegetables. But fruit sweet.
Yes, but it's a
The
healthy
banana
sugar.
sweet,
It's
the
a
papa
healthy
sweet,
sugar.
all of them sweet.
Well, it's up to you, but what I would suggest is if you replace the chocolate that is sweet for the fruit that is sweet, you will fare better. And in terms of the exhaustion now, how you sleep?
Okay. Not too good.
Mm-hmm. How many hours are you getting at night?
I never come that, you know.
Well, okay, what time do you go to bed?
Anytime.
Oh. And what time do you wake up?
Well, sometimes you try to start to week now.
Okay, so you have to.
But sometimes I just get up. So it's
Okay. So would you say you get roughly 6 hours or less than that?
6? That's only like plenty.
Okay. And any problems with breathing? Do you snore at night?
Oh my Lord, get this to my funny road.
All right. So you're not really looking at here now. The issue with your sleep, you're not getting restful sleep.
Oh,
Because once you're snoring, you're not getting your deep sleep, and therefore you are going to be tired. Even though you're in the bed for some hours, you know, you are actually not getting the type of sleep that makes you recover and feel energetic the next day.
What about if I sleep in the day?
Well, that's another thing we need to talk about, because if you sleep in the day, that's going to affect your ability to sleep at night. So if you're sleeping in the day, it has to be a short nap. Do you sleep in the day usually?
But if I'm tired, I
Okay.
go lie down.
And how long you would lie down for?
Oh, I don't know, you know, when I feel to get up, I don't watch the clock.
Alright, so you see how you know normally you go by the doctor and get a prescription? The prescription I'm giving you today would be for your diet and for your sleep. You think you want to agree to that? I'll tell you how long you could nap in the day and how much sleep you need to get at night, and you're not drinking coffee and things before you go to bed. Do you?
Well, I'm down to 1 cup of coffee a day now.
Alright, but is that
And we
before
drink one
bed?
in the morning.
In the morning,
Mhm.
alright. So we want to reduce the caffeine, see if we can get you into green
Less than a
tea.
cup of coffee? Then I ain't drinking no coffee.
Alright, okay, so we agree to the 1 cup of coffee,
Okay.
more fruits and veg,
Mhm.
no chocolate, a
Mm.
short nap, and you'll get some proper sleep at night, okay?
I could try.
Well, I would want to see you back. I'm glad that you're agreeing to that. I would want to see you back in, let's say, 2 weeks, okay? And it will be a quick visit, just to see how the sleep is going, and then we'll do some blood tests to see that your body is benefiting.
If
from
I
the
follow
rest.
the diet, how much weight do you think I will lose in 2 weeks?
Well, the thing is, I can't guarantee exactly how much, but it will also depend on you. And of course, we didn't talk about the exercise, but you know, you need to keep moving, right? So,
But I've been walking up and down at home. But you forget I'm a housewife. So I have to wash, clean house.
okay, so
All
you're
that is
active.
exercise.
No, but you're
All that
right.
is exercise.
That is very good.
I need to
Very
go
good,
to
Miss
gym and walk
John.
around no survivor.
I need to get some advice from you then. All
Yeah,
right.
it's
So you're getting
dormant,
activity.
Dormant.
Uh-huh.
And then doing housework now.
All right. So if we could increase it a little bit, how about a walk around the block? Just add a little more to what you're doing now.
I can see.
Right?
I can see.
And of course, not in
I
the
think I
house.
have not to do that with me. I can walk around the block by myself.
Is there anyone you can walk with you?
I don't know, the check and see. I'm sure I must have a partner to find the walk
If
around
there's
the block.
anybody else who's at
Yeah.
home, they may go to that.
Home.
So
I can
see if you're agreeing with this,
Mhm.
right?
Diet, sleep, exercise.
Yes.
Some Lisbon.
And I'll see you back in 2 weeks. I'm looking forward to seeing an improved you, right?
Yeah. Even if I lose 5 pounds.
Remember, it's not just the pounds, eh? We need you to rest.
Okay.
Okay? Because
If
do
I
you
sleep,
really
I can
lose...
put on weight.
no, actually, I was just
Oh,
about to
okay.
say, if you get enough rest, you also lose weight.
So
Yes, your
I can
metabolism
sleep
is...
more then.
So you can sleep more, but not in the day,
Oh.
in the night.
Okay.
Right? And do you know as you lose weight, you also snore less, which will
Oh.
allow your sleep to be more deep,
Okay.
right? So,
Okay. Thanks, Doc.
Ms. John, it's always a pleasure.
Yes, yes.
Thanks for coming.
Thank you, Doc.
Excellent. And again, as we did for the first couple, please let's give them a resounding round of applause. Anybody who wishes to come, there are seats still available. But somebody might need to give you a little assistance. Would somebody in one of, well, maybe on this side, mind giving a seat? No, I don't want her to come down the step. I'd like her to sit on that side. Yeah. Thank you very much. You can come and sit here. Thank you. Anybody else who's touching down there would like to come in? Don't let me call you by name. All right. So we have Dr. St. Bernard as a doctor in a different setting, in an office setting. And we had Ms. Jennifer John as a patient, and I think they were both extremely effective. So this should be interesting to hear your comments on how this interview went. No, silence means it went very, very well. But the purpose of this exercise is not to just sit there and say, yeah, it was good, it's to share with everybody so that everybody can learn from what we have seen. Now, like in the first interview, the doctor in this situation did offer help to the patient, to the client as they came in to sit, which was noticeable and noticed, and I'm sure even though you didn't say you noticed it. And the help was accepted, because sometimes help is not accepted because people feel that you're making them older than they are, or they can do this on their own, they're just coming to you for something else. So you need to be cognizant of that as well. The correct name, all of these things were done in both interviews, getting the name, and each of the patients had a particular issue with their name. That brings to the point that names are extremely important, and we really should, as a matter of course, confirm the spelling of persons' names and the pronunciations where possible, so that you can speak to them and speak to them as they would like to be spoken to. If somebody is, I have a friend called Ann Jenny, and people call her Anjani, and it is Ann Jenny, it's A-N-N, and then a capital J-E-N-N-Y. It's not A-N-J-E-N-I or whatever other variation there is, and she gets very upset if people don't call her name properly, so it is something that's valuable. The Panadol versus the paracetamol. Now, we're not doing academics really, but we know that Panadol is paracetamol and paracetamol is Panadol. This might have been a good opportunity in a real life setting to just let the patient know that they're actually the same thing, because they might go and buy the generic paracetamol and then buy the other Panadol and realize it's the same thing. In an interview like this, you can't go through all of those things, so Dr. St. Bernard wouldn't have brought that up at this point necessarily. But it is good to clarify certain things. Similarly, in the first interview, when Mr. Carter said the radiographer did a report, it's not the radiographer who does the report, it's the radiologist who is the medically trained person. The radiographer is the technician who does these things, as you all probably know. But for the patient's point of view, and if we had longer for these vignettes, the doctors would have said, okay, well, it's actually every opportunity you get to educate and to assist, to make things better for the patient, you can do. Okay. We got on to the question about diet with Ms. John. And before we actually step onto that, remember, Dr. St. Bernard asked, what would you like me to call you? How would you like me to address you? And Ms. John gave her the opening to say whatever. Now, if she had been forward, she would have said, okay, Jenny, which would have been wrong. If she had said, okay, Jennifer, that would have been okay, because she did give her license to call her what she liked. But it's always best to err on the side of caution and use the title, Miss John or Mrs. John or Dr. whoever, until you get comfortable in the relationship where you're not going to be slapping them on the back, hey, Jen, what's going on, and so on. But you know, you eventually, because of the social nature, if you keep seeing a patient, particularly in a private setting, you do tend to have a more social relationship, and you can spend the first 15 minutes chatting about various things before you actually get to the problem. This also eases the patient's fears and makes them feel more comfortable. Good. So with the diet now, you will notice, you'll recall that Dr. St. Bernard gave alternatives to the diet. And Ms. John was saying, oh, but I like cake and I love the chocolate. But something was getting to her which made her say, okay, I will try. You have a comment? I'm talking because I want to. No, I want you. I'm just talking because nobody else is. So please.
Okay, well, I don't know if anybody else noticed, but it seemed as if the doctor sometimes had to cut the patient off